Hi, my name is Judie VanKooiman, and you're watching Life Issues. May's show is about clear, and my guests are Meredith Hurley and Sarko Jarian. Welcome, both of you.
Thank you.
Meredith, I'm going to start with you. What is your professional background?
So I am the current director of public health for the town of Winthrop. I started working for the town 10 years ago as a public health nurse, and then after a few years I transitioned and worked at the high school for about 2 years as the nurse there, before returning to public health on the town side in 2019. Prior to doing public health, I worked for 12 years? Yeah, 12 years as an inpatient pediatric nurse at Children's Hospital.
All the little ones.
All the little ones.
Oh, I can tell that you're very passionate
I
about
love
being a nurse. Yes. So Meredith, what does CLEAR stand for?
CLEAR stands for Community and Law Enforcement Assisted Recovery.
Okay, thank you. And what is the mission statement?
So the mission statement of the CLEAR program is to ensure that individuals seeking support for mental health or substance use services are connected with community-based service providers.
Okay, thank you. And Sarko, I'm going to turn to you. What is your professional background?
Sure. So I came into policing in my 30s. I'm at the rank of lieutenant right now, and I'm assigned concurrently to public safety and public health. It's a joy of my life because I get to create matters from the police data set for public health. The same data set that the detectives use to make cases for court. I'd like to say that because I think it's really important and it's foundational to CLEAR. I also have master's level training in mental health counseling, so I see adults nights and weekends for psychotherapy.
Okay, great. And how long has the CLEAR program been in existence?
So since about 2014, so 10 years, or a little over 10 years now.
Okay.
Yeah.
It's grown.
Yeah.
Cool. And what does CLEAR program consists of?
So we have a multidisciplinary team in the Public Health and Clinical Services Department, which is comprised of recovery coaches. We have 2 of them now. Social worker, who's also trained as a mental health counselor. Resource navigators, we have 2 of them. And a domestic violence sexual assault caseworker. And we're lucky enough as well, Meredith was able to bring in a program manager as well to the team. And I sit in the public health department as well with the police computer system. So we're very close in proximity, and I like to say we rub off on each other in a positive way.
Yes. Yeah, good stuff. And Meredith, how does the CLEAR program work?
So when we first started, we were looking for. The impetus was the opioid epidemic, which was really getting a lot of attention in like 2013, 2014. The town of Winthrop was really experiencing some a fair amount of fatalities related to opioids, and we'd gotten a small amount of seed money, grant money from the state to figure out ways to decrease overdose deaths. So with that, I had a conversation with Chief Delahanty and then Chief Paul Flanagan and the fire department, and we were trying to figure out some ways, some strategies to do things differently, because what they were seeing, I had asked them a question, these statistics really are painting a grim picture. Is it as bad as the statistics are saying? Is it better, or is it worse? And they both said it's far worse than what you're seeing on paper. They were talking about the recidivism, the loss of life, the fatigue within their departments. I have to give Winthrop a lot of kudos, though. Even by 2014, they were one of the first departments to start using naloxone, also known as Narcan, which is a rescue medication for opioid overdose. So they were well ahead of the curve. They were utilizing really any tools that were being presented to them at that time. So, we had talked about that, and there was this emerging practice of utilizing peer recovery coaches, and we were just trying to figure out what our model was. And then, Chief Delahanty had introduced me to now Lieutenant Judarian, then Patrolman Judarian, who was really interested in looking at police data to identify non-criminal matters, really quality of life issues that were that we could, do targeted outreach. So as we started this program and it's evolved, it was going through police data, recognizing opportunities of intervention related to, initially it was opioid overdose, and then utilizing our peer recovery coach to then go out and offer services versus, we really wanted to keep folks away from diversion and divert them away from criminal justice systems and divert them away from death, really. And so that was where it started. And then it's evolved from there, for sure. We quickly realized that there was more than just opioid addiction going on in our community. And we were kind of, our hands were technically kind of tied because the only money that we had to do any of this work was tied specifically to opioid overdoses. But we were quickly seeing, we were having people come and say, my child doesn't have an issue necessarily with opioids, but alcohol, stimulants. And technically what we were supposed to do was to say, oh, sorry, we can only help folks with an opioid addiction. But we were able to pivot and figure it out. And then in 2016, we added our social workers to the team, recognizing the co-occurrence that often happens between addiction and mental health. And also, kind of flagging those matters that involve mental health, addiction, and then it kind of evolved from there. So initially the majority of our connections with residents were coming through police data sets. Now we have multiple different ways that people can be in touch with us. But Sarko can talk a little bit more about kind of how he goes through the data sets and the logs and how it's evolved into now having other officers that are doing it.
Sure. Yeah. So, at the same time that Meredith had turned to people with lived experience for some guidance on a situation that we were calling an epidemic, right? It had escalated to the point where I think now we're over 100,000 deaths a year related to substances that cause overdose situations. At the same time she turned to people with lived experience, I asked Chief Terrence Delahanty if I could, on patrol, go and find people and families and talk to them about their challenges. And it's very normal to think, how would I know about their challenges? But people call 911 and tell a dispatch call taker about their challenges. I get to see every single one of those calls as a patrol officer, right? And that information is chock full of actionable information, where at the time we were doing nothing with it, right? If someone called about something that wasn't a criminal matter, we would take care of it and be done with it. That was it. It would go into the computer systems and be forgotten about, right? But those logs and police incidents have indicators like depression, anxiety, ran out of meds, couldn't make it to my appointment, right? Well-being check on somebody who happens to be elderly, struggling with something. So luckily, the chief gave me permission. He didn't think anyone was going to talk to me, but I came to him with a problem. I gave him an idea around a solution which wasn't going to cost him any money. So he said, go ahead, give it a try, right? Lo and behold, going in with the right heart and mindset, even if you're dressed up in full police garb, vest, gun, and everything, people open up to you, at least in Winthrop, right? So I was able to circle back and say, Chief, people are telling me they have issues. We got to find a place to connect them to. And he said, contact Meredith. Contact the public health department. Mm-hmm. So I say that when we did that, when that happened, we succeeded at establishing a police to public health pipeline to help people with matters that should be diverted and deflected out of the criminal justice system. And that was 2014.
Okay. And Meredith, what is the vision of CLEAR?
So really what we work towards is decreasing barriers for folks that are experiencing, we call it quality of life, like diminished quality of life, whether that's, and we try not to bucket it into necessarily specific, I mean, we bucket it into specific things, but we want to really make a collaborative, like cross-sector program. So what we try to do is, whether it's somebody that is, the addition of our resource coordinators has been really phenomenal because, for example, we would, be working with somebody who is struggling with addiction and is seeking recovery, and they're seeking either a detox program or they're seeking an intensive outpatient program. But with that comes challenges of what does that do to work? What does that do? That presents challenges with childcare potentially. And so, not only are we just looking at it as treating the addiction, we try to treat the entire either individual or family on multiple levels, meaning that our resource coordinators can go in and help figure out a solution for, okay, like what does rent look like? How can we help support you to stay? Because it's really challenging for people to, improve their quality of life if they are, risking housing stability, or they're risking food insecurity, or they don't have childcare. And, those are all things that transportation was a big one at the beginning and still is. But, from the get-go of us kind of launching this initiative, the public health department had very limited resources. So really leaning into our public safety partners that had, I wouldn't say that they're over-resourced, I would say the opposite, they're generally quite under-resourced, but had more resources. And so we were, they were willing to share their resources with us. And one of the first things that we did was Chief Delahanty committed to, if there was somebody that was seeking treatment, it didn't, not that it didn't matter, but the police department has taxi vouchers. And so we would use taxi vouchers to send people to whatever program they were seeking, mostly inpatient detoxes, free of charge. Just,
Nice.
So it built a really nice, trusting, transparent, compassionate kind of relationship for folks that are so burdened with stigma and shame that, to be able to just lead with like an open heart and a compassionate place has been really these foundational pieces that have built the culture within what we've been trying to do, or what we have been doing for sure.
Okay, great. And Meredith, there's a poster that is kind of floating around that was first made around COVID time. Thinking of You, Visitation Awareness. Can you please talk about that?
Sure. So February is Visitation Awareness Month. So as we've expanded out, it's like you start looking at opioid overdoses, then you look at addiction, and then you look at mental health, and then you look at, and then COVID, came into our world, and then you're looking at isolation and kind of this collective community trauma that can happen from either on an individual level, a family level, an interpersonal level, a community level. And one of the things that we felt was important was recognizing for, especially for elders, the Surgeon General came out this year and said that loneliness and isolation in our older population is really a high emerging public health threat. And you can see that coming out of the post-pandemic. So every February we try to highlight that and bring some education around that. that, you know, those in our community that are aging, they have less opportunity for social interaction, and the benefits of social interaction for, you know, for all of us, but especially as you're aging with the effects on cognition, you know, there are the statistics that show, you know, much higher rates of Alzheimer's and dementia in those that are isolated. So we've used that as just a way to highlight the importance of just checking in on each other and, you know, just kind of encouraging those human contacts.
So important
Yeah.
as you get older. Because I've known seniors that don't have anybody, no family, no visitors, you know, just stay in their apartments and stuff, and it's too bad.
Yeah, it is too bad.
Okay, and Sarko, can you please tell us about your team and who does it consist of?
Sure. So right now, the recovery coaches, we have two of them, Chip and Eric. The resource navigator team is Zoraida and Bob. The social worker is Jane. Program manager is Dorothy. An officer is assigned to the team, Phil. And the vet affairs, we consider him a part of the team. His name is Phil. And who else? Is that everybody?
Domestic violence. Sexual
Domestic
assault.
violence. Lee.
She's our newest member.
Yeah. And we have a representative from Winthrop Fire show up to some of our meetings. His name's Ryan. Yeah, I think that's
a little bit of
everybody.
everything. That's great.
Yeah.
Yeah.
Yep. And we do a weekly roundtable, and the whole program is based on verbal consent, in particular on the police side. So I think it's important to mention that. Just because I have somebody's information as a law enforcement professional doesn't mean I'm going to make the assumption that they even want help with their story.
Right.
So we send the officer in person to go get that verbal consent, eye to eye with the person. If we can make person-to-person contact. If not, we try to find them over the phone, whatever we can do to get verbal consent. With it, we move the matter into the public health team, starting with the appropriate person on the team. Without it, we don't do anything. Because a lot of these situations are long-standing. They can be chronic. So, you know, if I see it in the dispatch log, I will flag it again. I will go back to the house again. I'll use it as an opportunity to practice my interpersonal skills and my motivational interviewing to get the person to trust me and say yes.
Great.
Yeah.
And how would you help someone with addiction?
Well, the first thing I would do is try to find them. All right, try to find them and have a conversation with them. It's really important to build trust and rapport, and sometimes that takes, like I said, more than one effort, right? I've gone to houses 7, 8, 9, 10 times before a person has said, you know, I just can't believe how often you're coming to the house. I do need help. Thank you for coming back, right? So after that happens, and I see my role as somebody that, my main goal, right, this trackable data point that we hold on to is get the person to say yes to me, right? Because that's going to help me connect them to people with lived experience, our recovery coaches, in the public health department, so that they can meet up and start working on a recovery wellness plan, which is always based on what they think they need and want, what they think they need and want, not what I think, not what society thinks, right?
Yeah.
So this is an important point, because in recovery coaching, there is an intentional attempt at leveling out power differential. They're meeting people where they're at and exploring what they think they need and want. So that's what I would do.
Cool. Good. And what are the 4 things to remember?
Well, the first thing that comes to mind is the importance of harm reduction, right? Without a living, breathing person, recovery isn't possible. And we know right? There's evidence-based science out there that says people can learn to be safe around any activity. So making sure that's one of them, making sure people know that there's ways to reduce harm so that they can be safe so we don't lose them, right? The next is connecting with people with lived experience who've recovered from the similar challenges so that they don't have to walk the recovery path alone. That's if they want it, right? The third thing I'd say is it's okay to reach out for help. Find out who you can turn to, who you can trust, and thank you so much for having the show to get this information out there. And dare to ask for what you need, because you might get it.
Those are good ones. Good, thank you. And Meredith, can you please tell us what are the 6 resources people can get help at?
Addiction, so anything substance use related, mental health, resources, meaning like social determinants of health is kind of the catchphrase of housing, transportation, food stability. We've even, helped folks with training and so like training in occupational opportunities, domestic violence, sexual assault. I believe that's it. Am I missing anything?
Well, we also have the veteran services.
Oh, and veteran services.
Yeah, I think that's more than 6.
Good. And Meredith, does each state or town have something similar like CLEAR?
No, not. It's definitely emerging. I have to say we have been very lucky to have started this in 2014 because there is such you can see now these becoming best practices across the country. Definitely more so in the state. We have had opportunities on both sides. In police terms, they have a term like when they're talking about staffing, it's called 2 sides of the house. And so I kind of end up using that vernacular, and I say on both sides of our house, public safety and public health, because we do sit under one roof with the work that we do. So we have had the opportunity on the public health side to mentor, to be recognized as a program that can lend mentorship and leadership and support to other regions that are looking to build similar programs. So, for example, from the public health side, we've mentored Mobile County, Alabama Health Department on the utilization of peer recovery coaches and harm reduction models. And we also concurrently worked with a health district in Michigan, Barry-Eaton County, which is right close to about an hour outside of Grand Rapids. So through some work with some national organizations, they gave us funding to be able to do this, and then we went and did site visits with each of them and sat in their communities for 2 days.
Great.
And had meetings. And then on the public safety side, we have been working for over 2 years now with the Bureau of Justice Assistance on a mentor program to help police departments utilize peer recovery services. So last year we worked with Alamosa, Colorado, Eau Claire County, Wisconsin, and also more locally Linfield and Swampscott. And we have a call, I think next week, because we have 3 additional police departments coming up for this year, and they are in Ohio, also in Kansas City, and then one, I believe, is a Navajo Nation. I think that they added a 3rd one. And we have also been working for a few years with PARI, which is the Police Addiction Assisted Recovery Initiative, right? I always fact check with
They're
Sarko.
so long. They
They're
get
so
longer when you
long.
mix
That
up
was
letters.
born out of the Gloucester Angel Initiative. So we've been working with PARI for quite a few years and presented at their national conference in December with Chief Delahanty. And also Sarko and I went to Washington, D.C. in December as well with PARI to speak to the Congressional Caucus on Addiction and Recovery to kind of spread the word about these programs, because you know, in 2021, 2022, when there was kind of the upheaval and social unrest following George Floyd's murder, and you know, and the defund the police and things like that, and there was this conflict that was arising between public health and public safety, because you know, there was a lot of talk about taking money away from policing and putting it into more public health systems. We were able to kind of sit back and not engage as much in that conversation, other than to say, yes, we have been working on similar strategies since 2014, and not have to have that conversation in such like a tension-filled time, and to be able to sit back and kind of more or less serve the community as we needed.
Okay. And what is ROC?
Oh, so the ROC was the initial group that started this whole work. So it was Winthrop, Revere, Chelsea, and Saugus. So it was the Winnisumet Regional Opioid Collaborative, because the Winnisumet Native Americans all lived in our areas. And so we had a 10-year grant between all of us that really was the catalyst for all of this work. And now we're united, with the exception of Saugus, under the North Suffolk Public Health Collaborative.
Okay, great. And Meredith, can you please give us your contact info?
Sure. My email is the best. It is mhurley@town.winthrop.ma.us.
Okay, great. And Sarko, can you give us your contact info?
Sure. So it's SGERGERIAN at town.winthrop.ma.us.
Okay. I'm sorry, but that's all the time that we have. Thank you both for all you do for those in need. I love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.